Your dog may seem healthy, but their heart could be crying for help. Heart diseases are more common than you might imagine, especially in elderly dogs or small breeds. The canine heart works like a tireless pump, beating thousands of times per day to carry oxygen-rich blood throughout the body. When this vital pump begins to fail, the signs can be subtle at first, but progressively become more evident. The main causes of heart failure include advanced age, genetic predisposition, obesity, bacterial infections, and prolonged sedentary lifestyle. Having the correct information about heart health is essential to protect your best friend. And you find this knowledge here on the Dr. Doug the Dog channel, so feel free to subscribe and support our work. Today, you will discover the 8 most important signs that indicate problems in your dog's heart. Learn to differentiate them from common symptoms, and understand why early detection can add years of quality to your companion's life. Let's go. Sign 1. Persistent cough with no apparent cause. This characteristic cough happens because fluid accumulation in the lungs caused by heart failure constantly irritates the airways. Unlike a common cough from a cold or something stuck in the throat, the cardiac cough is dry, repetitive, and does not improve with normal cough medications. Veterinary cardiologists know that this cough worsens especially during the night or when the dog lies down, because the horizontal position facilitates pulmonary fluid accumulation. What makes this sign even more revealing is that the cardiac cough frequently comes accompanied by a characteristic sound, almost as if the dog were trying to constantly clear their throat. Experienced professionals can identify this pattern during auscultation, noting that the cough intensifies after small efforts or excitement. If your dog has developed a cough that persists for more than 1 week, especially if it worsens at night or when lying down, this is a classic sign that deserves immediate cardiac evaluation. Sign number 2. Easy fatigue and loss of energy. Dogs that stop in the middle of walks, lie down earlier than usual, or avoid games they previously loved may be dealing with a heart that cannot pump enough blood to supply the body's demands. What happens internally is that the weakened heart muscle cannot send adequate oxygen to the muscles and organs, resulting in early fatigue. Veterinarians observe that this apathetic behavior frequently manifests gradually, with the dog showing less enthusiasm for daily activities. Specialized clinics notice that cardiac dogs tend to seek cold surfaces to lie on, breathe more heavily after minimal efforts, and may even hesitate before climbing stairs they previously ran up. The concerning thing is that many pet owners attribute this change to natural aging, losing valuable time for early intervention. If your companion is showing fatigue disproportionate to the effort performed, especially if combined with reluctance for exercises they previously did easily, this behavior may be signaling cardiac overload. Sign 3. Accelerated breathing even at rest. Observe your dog during calm moments and notice if their belly rises and falls rapidly, even when they are relaxed and in mild temperature. Accelerated breathing happens because the compromised heart forces the lungs to work more intensely to compensate for deficient oxygenation. Veterinary cardiologists explain that the normal respiratory rate of a dog at rest should be between 15 and 30 breaths per minute, but dogs with heart problems frequently exceed this limit. What makes this sign particularly useful for diagnosis is that it can be easily monitored at home during sleep, when the dog is completely relaxed. Professionals recommend counting breaths for 1 minute while the animal sleeps, because this is the moment of lowest metabolic demand. Modern clinics teach pet owners to observe if breathing seems labored, if there's excessive movement of the abdominal region, or if the dog constantly keeps their mouth open to breathe. A valuable tip is to observe the respiratory rate during sleep for 3 consecutive nights and record the results. Sign number 4. Pale or bluish gums. The color of the gums is a direct indicator of how well blood is being oxygenated and circulated throughout the body. Healthy gums should have vibrant pink coloration, similar to the inside color of your mouth. When the heart cannot pump efficiently, the gums may become pale, whitish, or even develop a bluish tone, especially at the edges. Veterinarians use this simple examination as a quick diagnostic tool because it offers immediate information about blood circulation. The capillary perfusion test, where the gum is gently pressed and you observe how long it takes for the pink color to return, also reveals much about cardiac efficiency. Professionals know that color return should happen in less than 2 seconds in healthy dogs. Clinics teach pet owners to perform this check weekly, especially in elderly dogs or predisposed breeds. This is truly one of the easiest signs to check at home, requiring only a few seconds and providing valuable information about your companion's cardiovascular health. Sign 5. Fainting or sudden weakness. Episodes of collapse, loss of balance, or fainting happen when the brain does not receive adequate blood flow due to failure in the cardiac pump. These events may last only a few seconds but are extremely alarming and always indicate serious cardiovascular problems. Veterinary cardiologists explain that cardiac fainting frequently occurs during or immediately after physical effort, extreme excitement, or even very intense coughs. What differentiates these episodes from other causes of weakness is that the dog generally recovers quickly, but may seem confused or disoriented for a few minutes. Professionals observe that some dogs develop a pattern where they avoid activities that previously caused fainting, instinctively demonstrating that something is wrong. Emergency clinics always treat fainting as a medical urgency because it can indicate dangerous arrhythmias or advanced heart failure. If this happens to your dog, go to the veterinarian immediately, even if they seem to have recovered completely. Note the circumstances of the episode to help with diagnosis. Sign number 6, swollen abdomen or strange weight gain. When the heart cannot pump efficiently, fluid can accumulate in the abdomen, causing a condition called ascites. This abdominal swelling is not accumulated fat, but rather fluid retention caused directly by heart failure. Attentive pet owners can notice that the dog's belly seems rounder or more tense than normal, especially when viewed from the side. Veterinarians teach a simple technique. Place hands on both sides of the abdomen and feel if there is a wave sensation when moved gently, indicating presence of free fluid. What makes this sign particularly deceptive is that it can be confused with normal weight gain or temporary digestive bloating. Experienced professionals know that cardiac ascites generally comes accompanied by other symptoms like breathing difficulty and fatigue, creating a characteristic picture. Clinics use ultrasonography to confirm the presence of abdominal fluid and determine the accumulated amount. If you notice that your dog is developing a swollen belly without changes in feeding, especially if accompanied by other cardiac symptoms, this combination requires urgent veterinary evaluation. Sign number 7, loss of appetite and weight loss. The tired and overloaded heart affects the entire body metabolism, frequently resulting in decreased interest in food and gradual weight loss. This loss of appetite happens because the constant fatigue and discomfort caused by heart failure create a persistent sensation of malaise. Veterinarians observe that cardiac dogs may show initial interest in food, sniff the bowl, but end up walking away without eating adequate amounts. What concerns professionals is that this weight loss is frequently gradual and can go unnoticed until it becomes significant. Specialized clinics notice that muscle mass loss, especially visible in the rib and hip region, is a late indicator of chronic heart problems. The relationship between cardiac fatigue, abdominal discomfort from fluid accumulation, and lack of desire to eat creates a cycle that can accelerate the deterioration of the condition. Professionals recommend monitoring weight monthly in elderly dogs. because a loss greater than 10% of body weight in 2 months without intentional changes in diet always deserves complete cardiovascular investigation. Sign 8. Changes in sleep and sleeping positions. Dogs with heart problems frequently develop difficulties sleeping in the completely lying position, preferring to remain sitting or leaning against furniture during nighttime rest. This behavioral change happens because the horizontal position facilitates fluid accumulation in the lungs, making breathing difficult and creating a sensation of suffocation. Veterinary cardiologists explain that when the dog lies down completely, the heart needs to work against gravity to pump blood adequately, increasing cardiac effort and worsening symptoms. Professionals observe that nighttime restlessness, with the animal constantly changing position or getting up several times during the night, frequently indicates respiratory discomfort caused by heart failure. The diagnosis of heart problems involves simple but very revealing exams that veterinarians use routinely. Cardiac auscultation can detect murmurs, arrhythmias, or abnormal sounds that indicate turbulence in blood flow. Chest radiographs show the size and shape of the heart, as well as reveal fluid accumulation in the lungs. The echocardiogram, a heart ultrasound, allows visualization of valve function and pumping capacity in real time. The importance of regular consultations becomes even greater after 7 years of age, when the incidence of heart diseases increases significantly. More predisposed breeds include Poodle, Dachshund, Cocker Spaniel, Chihuahua, Cavalier King Charles Spaniel, and Yorkshire Terrier, which should receive even more rigorous preventive cardiological attention. Adequate treatment can provide exceptional quality of life for many years after diagnosis. Modern medications help the heart work more efficiently, control fluid accumulation, and maintain blood pressure at healthy levels. Diets with controlled sodium restriction reduce fluid retention, while light and regular physical activities strengthen the cardiovascular system without overloading it. Veterinary cardiologists emphasize that many dogs diagnosed early live additional years with preserved energy, appetite, and joy. Regular monitoring allows treatment adjustments as needed, always maintaining comfort and well-being as priorities. Detecting early really makes all the difference between a life limited by disease and additional years of happy and healthy companionship. The heart speaks, if you know how to listen. Each beat represents unconditional love, loyalty, and the will to be by your side for as long as possible. Attentive observation of the signs we discussed today can be the difference between detecting a heart problem when it is still treatable and discovering too late. Remember that love is also preventive care, regular consultations, and attention to small details that your companion cannot express in words. Veterinarians always say that the best detectives of heart problems are the pet owners themselves, because you know each breath, each energy level, and each normal behavior of your dogs. Your dog's heart works tirelessly for pure love and total dedication. Take care of it with the same intensity, observing, protecting, and acting quickly when something seems different. After all, this heart beats exclusively for you.